Hello, this is Jennifer Alonso with the San Luis Valley REC Power Up show. Today I've got a couple folks here from San Luis Valley Health, and we're going to talk about the most popular topic today, which is the coronavirus. So I've got Jessica Garcia, who is an RN and the infection prevention practitioner for San Luis Valley Health, as well as Ryan Daugherty. He is the director of EMS in Alamosa, as well as the Emergency Preparedness Coordinator of SLV Health. So they're going to talk to us a little bit about the virus, the symptoms, prevention, and what's being done locally through SLV Health to kind of curb this and get it under control. So thank you guys for being here. I appreciate it.
Thank you for having us.
Yeah, so go ahead. I'll let you take over and kind of tell us what's going on.
Essentially, the coronavirus is a respiratory illness. The most common symptoms that we're seeing are fever, cough, shortness of breath, and some of those things can kind of go along with other seasonal respiratory illnesses that we see. But, some of the things that make people more at risk for having this virus in particular is, being exposed to someone who's known to have it, recent travel to areas where there's community spread of the virus, and things of that sort. So really the best method for curbing the spread of all of this is prevention, and so we really want to encourage people to observe respiratory etiquette, which means, cover your cough into your elbow. If you're going into an area and you're sick, put on a mask or avoid those areas in particular. Because really staying home when you're sick protects other people from catching whatever you might have. Also, observing good hand hygiene, so washing your hands with soap and water, using hand sanitizer if soap and water is unavailable, and really, social distancing, so avoiding large crowds. Really, if you're sick, stay home if you can manage your symptoms at home.
Good. So locally, what are you guys doing to kind of prepare?
Well, locally, I think the message is these can be times of uncertainty and worry for sure with everything that you see on the news. For the most up-to-date information for everybody from credible sources like CDPHE or the CDC, there's a lot of information out there, but I would direct people to the San Luis Valley Health homepage, where we have some links to get the most up-to-date and credible information, and also local area information. I think it's important to note that we do not currently have any confirmed positive coronavirus cases in the San Luis Valley, but that can also change rapidly if you look at how the virus has spread in other communities. There should be a high grade of caution for sure. And something from an emergency preparedness and management standpoint, emerging infectious diseases such as this one, pandemic, this isn't the first one globally, and it won't be the last. So something that emergency preparedness coordinators and managers in any of our communities have been able to spend a lot of time on is concentrating on what are the plans of action at a local level, regional, state, federal, for when emerging infectious diseases present. And we're no different in our community. We are very well prepared. We've had some of these plans for years now, and now, making it more specific to this virus, we have stood up our incident command center at the hospital to ensure that we are continuing to monitor this, prepare, and then plan for a response if and when we need that. So, and what that culminates in is a relationship between the healthcare entities and the public at large, right? As Jessica said, the best way to get around this and to not get infected is basic infection control techniques, good hand washing, trying to avoid areas where there's large crowds, especially if you're in those high risk groups, 65 and older, if you're immunocompromised or have other chronic illnesses in any way. And then, staying home if you're sick. In addition to that, there always comes the question of, right now, what do I do if I think I have coronavirus, or if I have been exposed or recently traveled somewhere where I think I might have come into contact with that? Again, I would direct people to the San Luis Valley Health homepage. I believe there's an article in the Valley Courier that came out as well. We have created a nurse triage and screening line. There is one at the state level that you can get to on the CDPHE website for the most up-to-date information via phone, which is the CO helpline. That's very broad information, and as an organization, we did not feel like that was regionally specific enough and didn't answer questions such as, okay, I think I have come into contact with coronavirus, what do I do now? So the beauty of that line, and that phone number is 719-589-2511, and then you will be prompted to press 9. Once you do that, you will actually be connected to a registered nurse, a real person that can help direct your health care. And the importance of that is they can direct you to testing locations for this sort of thing and really guide you on whether you need to come to the emergency department, whether you need to go to the outside testing locations, or whether you should probably just self-isolate. It's important to note that there are a lot of other viruses that are normally going around during this time of the season, including seasonal allergies, which can produce similar symptoms. Flu season is still happening right now. So the main thing is not panic. Help us help you kind of direct that healthcare. And also to know that San Luis Valley Health as an organization has been preparing for this, has been preparing to respond to this for quite a while now. It's also important to note that with that, we are working very closely with local other healthcare entities, including clinics, the other hospitals, the Healthcare Coalition, nursing homes, There's a ton of local partners that we are working very closely with, including the schools and systems like that. We are working regionally with a lot of healthcare partners, and then you broaden that to state and federal agencies. And what that allows us to do is have a very coordinated effort to deliver good healthcare to our communities, to keep our communities as safe as possible, and continue as San Luis Valley Health to be your trusted partner in healthcare.
Good. Well, it's good to know that you guys are prepared. And so if somebody does feel like they have it and they call that line, do you guys have the capabilities to test right now? Can they be tested locally?
So we are able to perform the test at San Luis Valley Health in terms of obtaining the specimen that we need to send to the lab. So there's not any hospitals in the state that can do it at their locations at this point. They're working on those things, but we do have the state lab where we're sending specimens now, and then we have some outside reference labs that we can send it to. So that gives us about a 24 to 48 hour turnaround time to get the results back, and there are a few different testing criteria that we're looking at. If there's been recent travel to areas where community spread is documented, if they have the symptoms, meaning fever, shortness of breath, cough, or if they're sick enough to be hospitalized and there's really no other explanation for their hospitalization and their respiratory symptoms, those are all some things that would constitute testing for this virus in particular. But they are working on broadening that a little bit more with the more capabilities that we're gaining in terms of where we can test and how many people we can test and those types of things. So that will probably be changing in the near future, but the main thing is if somebody feels like they're sick and they may have coronavirus or are concerned about that they call us first, and we can, help them take the appropriate precautions to keep themselves and other people safe. So things are changing depending on the influx of patients that we might be seeing. We're looking at dedicated spaces for this type of thing. So that's why it's really important for people to call first so we can send them to the right place. We may even be sending nurses out to their car to give them a mask, or doing testing out there, because we really don't want to overwhelm our system either. Right. So even though people are sick, they might not need to come to the emergency room, because we don't want to flood the emergency room with things that are not true emergencies. And it's not that we don't care about how they're feeling ill and those types of things. But we could manage some things in the clinic, and leave the emergency room open for a lot of other things, because we see car accidents and heart attacks and a lot of other things that should go there, when these things can go to the clinic, where people can just self-isolate and manage their symptoms at home. And so that's why it's so important for people to call ahead.
Absolutely. And we certainly want to protect all the patients and our
the
staff
healthcare
and the
workers.
other
Right,
people
yeah.
around them as well,
Right.
because being in a large area with other people who may or may not be sick, it gets to a point where we just want to be able to direct that, so we're doing our best to protect everybody
Yeah.
involved.
And it kind of seems like that's the national and the Colorado trend as well, is kind of keeping those big, gatherings to a minimum. So I
Absolutely.
know they've canceled a lot of different events and things like that. What do you guys see as far as school closures? Is that going to just, time will tell, or what do you think will happen as far as that goes?
I think definitely time will tell. Schools, as well as everybody else right now, are just getting prepared and preparing their plans for this. Governor Polis came out on the news last night and created some better structure and guidelines around what schools should do if they start to have people that are sick in their systems. And I think, just a good grade of caution for general practices during even flu season without coronavirus.
Right.
If you're sick, try to stay home. If your kids are sick, don't send them to school. I think, dependent on the severity and the rate of what starts happening, it's difficult to surmise
Right.
school closures and things like that. But again, as you
Yeah.
said, I think it's dependent on what continues to happen. But people are ready to do that if necessary.
Yeah, good. My son goes to Adams State, and I know he was telling me this morning that there are a lot of colleges already that are going to do online stuff, and so it's neat that we at least have those capabilities out there.
Absolutely.
And I don't know necessarily which schools, but I know a lot of them do have the iPads and things like that, to probably where they could do a lot of at-home stuff, which is good. I guess that's an advantage to technology these
Absolutely.
days. But yeah, it'll be interesting to see what happens, and hopefully the panic doesn't overwhelm everybody and make it worse. So
Yep, absolutely. And I think as Coloradans, we are not unique, but especially in the San Luis Valley, we're resilient people. And people live here like people have for hundreds of years in a lot of cases. And I think that will go a long way to people's general preparedness and response to getting through this, because we will.
Yep, absolutely. Well, thank you guys. I really appreciate you coming up and
Thank
talking.
you.
Do you have anything to add? Or the phone number again one time was 589-2511.
And then you will be prompted to press 9, and we will give you some real person guidance.
Okay, good.
And continue to check the San Luis Valley Health homepage for the most up-to-date information from credible sources and local area information as well.
It sounds good. Thank you. We'll
Thank
see
you.
you next week on the San Luis Valley REC Power Up Show.